With autoimmune disease, it's very common to have multiple areas of involvement. Think about autoimmune disease kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids in other places too.
Welcome back to the Experience Health podcast. I'm your host, Rachel Vassar, and today we're diving into a topic I know many people want to know: putting autoimmune conditions into remission without relying on long-term medication. My returning guest is Dr. Kevin Smith, a board-certified functional medicine practitioner with over 20 years of experience helping people heal from chronic conditions by addressing the root causes. We'll unpack what's really driving the rise in autoimmune disease, why suppressing symptoms isn't the same as healing, and how the right environment can help your body calm inflammation and repair itself. So, without further ado, Kevin Smith, welcome to the show.
Thank you very much for having me. It's a pleasure to be back.
Absolutely. So, diving right in, I want to give people a little bit of introductory education on autoimmune conditions. So, first thing, can you explain what exactly is an autoimmune disease and how does it develop?
Okay, so autoimmune diseases well, first of all, the word autoimmune means self, and it means the immune system. So the immune system, which is your white blood cells that circulate throughout the blood, and their job is to protect you. So to protect you from bacterial infections or a virus or a parasite or some kind of a bad thing that may be in the body. And so what this defense system does is it circulates around and it tries to clean up the mess. So with autoimmunity, what happens is that this defense system starts to attack and destroy your own body tissues. So it depends on what body part is affected depending upon how it's named. Uh, Medical research has identified over 100 different autoimmune diseases, and they could range from, say, rheumatoid arthritis, which affects the synovial joints, a lot of times in your hands or in the spine. It could mean multiple sclerosis, where it affects the brain, or sarcoidosis, where it affects the lung fields. It can affect the colon, leading to Crohn's disease or ulcerative colitis. It can affect the thyroid gland, which is in the neck, and that is called Hashimoto's disease. So depending on which body part is affected depends on how it's named.
Yeah, it's really interesting how the body just attacks like certain tissues. How often would you say people develop multiple autoimmune conditions at once?
Well, I don't know the answer to that one. I do know that when with autoimmune disease, it's very, very common to have multiple areas of involvement. So you want to think about autoimmune disease kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids in other places too. So it's very common for somebody to have, say, a thyroid issue, Hashimoto's disease, and have some autoimmunity in their gut and their skin and the brain and other places. So it's very, very common. Anytime that somebody has some weird, unexplainable medical problem that cannot be determined based on basic lab tests, chances are it's some kind of a autoimmune condition.
Hmm.
And in my office, you're autoimmune until proven innocent.
Hmm. Interesting. How common is autoimmunity today compared to before? Because it's been increasing very rapidly.
I'm not sure that it's changed a lot in terms of its incidence or prevalence. I think that really what the truth is that it's become more and more recognized, or it's
Okay.
become as people become more informed, as medical doctors become more educated about what to look for and how to determine if it's autoimmune or not, then it is an area where a lot more people today are being diagnosed than before. Maybe before it was more accurate to say they were undiagnosed or misdiagnosed.
Okay. So when we're talking about before, are you saying that like even like 50, 100 years ago, there was probably still like a similar prevalence of autoimmunity compared to today, but obviously people weren't diagnosed because we didn't even have that in the textbooks?
Yeah, I think that 100 years ago, we didn't know half as much as what we know now, not even a quarter
For
as much.
sure.
Now, maybe 50 years ago in the 1970s or in the 1960s, a lot of things have kind of stayed the same, like the diagnosis of hypothyroidism. The techniques, the medications, the way of the diagnosis takes place, it stayed the same. It hasn't changed at all. Then now the names are a little bit different and the medications are a little bit different, but the general workup is the same.
Mm.
And how this relates to autoimmunity is that 90% of everybody that has low thyroid issues has Hashimoto's disease. In other words, 9 out of 10 people that suffer with hypothyroidism, and that includes people that have weight gain or low energy or fatigue, or their hair's falling out in clumps, or they have cracked and weak nail beds, either in their fingers or their toes or both. They have the loss of the outer one third of the eyebrow. They have infertility. So that's very, very, very common for women that want to start a family and they can't conceive and they can't figure out what the problem is. They can have insomnia, either problems falling asleep or staying asleep. They can have abnormal bowel problems, either constipation or diarrhea or both. Um, they could have abnormal skin, dry, flaky skin, or excessively oily skin. Now, with hypothyroidism, you don't have to have all of those problems. You could have one, or you could have more than one symptom. And all of that could be kind of traced back a lot to autoimmune disease because 90% of everybody has got Hashimoto's. Now, Hashimoto's is not an endocrine problem. It's an immune system disorder. So if you go to an endocrinologist for a immune system problem, it's kind of like hiring a plumber to fix an electrical problem. It's the wrong person for the job. So you have to first correctly identify the nature of the problem and then figure out the right solution to correct it.
Mm. Since we're kind of talking about um, thyroid Hashimoto's a little bit, can you talk about how conventional medicine typically treats thyroid autoimmunity and also autoimmunity in general? And where would you say it falls short?
Well, the quick answer is they don't. So when you have hypothyroidism and you go see a doctor like your primary care or family doctor, or you go see a medical endocrinologist, they're going to order a very, very limited amount of tests. And that's generally done because that's what the insurance company said that they'll pay for. So when you go to see a PCP or a family doctor, typically they'll order a TSH test that stands for thyroid stimulating hormone. And thyroid stimulating hormone measures the amount of TSH coming out of the pituitary gland that affects your thyroid gland. How much thyroid hormone does the thyroid gland make? On the other hand, when I order a thyroid panel, I order 10 different tests because I'm interested in looking at the entire metabolic landscape. So even if the doctor orders the TSH test, they're overlooking or completely missing two key critical tests. One is called a thyroid peroxidase enzyme, and the other is called an antithyroglobulin enzyme. And those are the two markers that you need to test to see if there's Hashimoto's present. And here's the scary part. Even if the medical doctors ordered those tests, it's not going to change their treatment plan whatsoever. They're going to give you Synthroid or levothyroxine or Cytomel, some other kind of derivative of thyroid replacement hormone. The research says that those medications help approximately 17% of everybody that has low thyroid. What does that mean? The other 83% of the people, it's not going to help them at all.
Wow.
83% of everybody that has low thyroid and is taking the correct medication in the correct dose at the correct time, and it's still not helping them. That's
Wow.
amazing.
And doctors tend to put people on these medications for like just like the rest of their life pretty much. So would you say 83% of these people are just taking these medications but not actually reaping the benefit?
That's correct. So if you're taking a medication and it's not helping you, my thought is, why would you take the medication? You know,
Yeah.
if it's
It's like,
not
oh, doctor
addressing the
told me to.
yeah, yeah, that's exactly what happens is that the God Almighty guy in the white coat told me to get on this medication. So I just listen to him and say, okay, well, my insurance is paying for it anyway. What do I have to lose? Except, their happiness, their quality of life, enjoyment, joy, things like that. Um, I it is frustrating for me as a functional medicine practitioner to see this stuff go on all the time because
Yeah.
there's millions of people that are crying out and asking for help, and nobody is coming to rescue them. And this, by the way, we're talking about 30 million people in America every year have Hashimoto's disease. Um, Probably eight to one in terms of it affecting women more than men.
Mm.
That's a lot of
Why?
people.
Yeah. Why? Can you explain why women tend to be affected by Hashimoto's, but also like autoimmunity in general more than men?
Boy, that's $1 million question. I don't have the answer to that one. I know that there's a lot of debate that goes on. What causes all this? Is it
Mm.
because of genetics? Is it because of the environment or toxins or whatever? So, the best explanation that I've ever heard has been that it's due to a life effect. Something really, really significant happened in that person's life. The birth of a baby, the death of of a parent, a big move, a change of a career, a divorce, a
Mm.
new house, some major event. I don't really know what the linkage is, but maybe it has to do with their stress levels or
Yeah.
whatever. Maybe, a lot of people, they complain that all this stuff happened after they got really sick with a flu and they were down
Mm.
for about 3 weeks, and then all of a sudden, kaflooey, they started to develop autoimmune problems. I don't know what causes it. No, nobody does. And
Yeah.
there's a lot of debate in the scientific journals about this.
Yeah. I heard one thing, one kind of like argument towards it. It's a little bit probably like half a joke, but you know how like men typically can't like they feel worse when they have like a common cold or like the flu or something than a woman does because they say that a woman's immune system is stronger than a man's. I've heard that argument of them saying that women develop autoimmunity more because of something like that. Have you
Yeah,
heard that before?
I've heard that joke too.
Yeah.
It's something like um a a a, a man, uh I forget how it actually goes, but it's like the man could be completely sick in bed and dying and feel like death warned over, and all of his organs are shutting down, and he's like on his last, he's circling the drain, and it's the same effect of a woman with a common cold.
Yeah.
Something like that. Yeah.
Oh my goodness. I think that's a funny. Would be interesting if that play. I do feel like that may play a potential role. I haven't seen any research in that, but that would be interesting to see. I personally think that like your nervous system, like HPA axis, has a really big role in connecting between like traumatic experiences or super stressful experiences and then developing an autoimmune condition because of the effect that it has on your stress. Um, why that differs, depending on like a man or a woman, I don't know exactly why, but yeah, it's definitely a really interesting debate for sure. Anywho, kind of diving back into what we were talking about before, what would you say? How do I want to put this question? I would say, how do you determine whether someone's, like, when someone comes to you in your practice, how would you determine whether someone's symptoms are autoimmune or inflammatory driven and not an actual autoimmune condition? How would you like determine between the two?
So one of the things that I do is I determine a lot of what's going on with the case based on what shows up on the lab panel. So if they order those before mentioned tests to check for Hashimoto's disease, then we know that that's what's going on. There's a whole mess of different tests that are specific to different types of problems, like
Hmm.
anti-nuclear antibodies and things like that. That again, we're dealing with the immune system,
Yeah.
and inflammation is another key component that is it, it's intrinsically linked to autoimmune disease. So I want to stop by clarifying the differences between acute inflammation and chronic inflammation. Acute inflammation is the good kind of inflammation. Chronic inflammation is the bad kind of inflammation. So, acute inflammation happens when you get injured or you get an infection or a disease process. So, it has four cardinal signs. It it hurts, it gets red, it swells, and it creates heat. And those are chemical signals that sets the stage for healing and repair on the body. It's the immune system regulates that. So chronic inflammation is when something starts that process and then disengages the shutoff button. And that's very, very damaging to even your cells. So it kind of degrades tissue and it prevents healing over time. And chronic inflammation is linked to every single disease process that we know about. Things like
Hmm.
cancers, diabetes, autoimmune disease, um, uh, pulmonary issues, all kinds of stuff. The biggest problems that we face in this country is heart disease and cancer, and there's no doubt that chronic inflammation plays a significant role in what's going on with that. So chronic inflammation is one of those things that I can measure on a lab panel and find out exactly where that person is versus normal and put them on a path to get rid of the inflammation so they can get back to uh, enjoying a balanced life. And that's one of the key components to putting autoimmune disease into remission is to tackle the chronic inflammatory processes that's going on in the body. Another thing that will put things into remission is by correcting problems like leaky gut syndrome. And leaky gut syndrome obviously happens in the gut. And what happens is that the gut wall in the small intestine is it's like a tube, and the bolus of food goes through the tube, and the walls of the tube have these finger-like projections that stick out, and they're called villi. And what the purpose of them is to increase the surface area of the interior of the small intestine. And as the bolus of food brushes past the villi, it absorbs nutrients into the bloodstream. And if it's done properly, those nutrients get absorbed correctly and everything's fine. However, with leaky gut syndrome, the cell walls separate, they start to break down. Think of like elevator doors opening. And then what happens is that the food particles pass through between the cell walls directly into the bloodstream. The body doesn't really know what that is, what's going on, and it sees this big dipeptide or tripeptide or a big food particle, and it thinks maybe it's a parasite or something that shouldn't be there, and so it attacks it. sends the antibodies to the lymphocytes, the monocytes, the granulated white blood cells, and agranulated white blood cells to attack it. And when that happens, it spins up the autoimmune cascade. And then all of a sudden, the immune system starts attacking your own body tissue versus the offending agent. And when you have a leaky gut problem, you also have a leaky brain problem. So there's another structure called the blood-brain barrier, which prevents toxins and other stuff from getting into the brain. And when you have a porous blood-brain barrier, these things can go into the brain and cause all kinds of problems. And lately, they have just discovered that you also have you can have a leaky lung barrier, so you can have pulmonary effects.
Mm,
So one thing can lead to three things.
yeah.
And why does this occur? A lot of it could be occurring because of some offending food that you eat that could cause a breakdown of the cell walls in the gut. So, doing a gut detox and repair is absolutely essential for containing this problem and making the person feel better. Um, did that answer your question? I kind of got off on a tangent.
That answered quite a few of my questions, actually.
Okay, good.
It's funny because um, I was literally just about to ask about like some of the main root drivers of autoimmunity, leaky gut, and stuff like that, and you kind of just covered everything that I was about to ask, which is super funny. So yeah, that answered my question and more. Beyond leaky gut, gut brain barrier, and things like that, what would you say are some of the other most common root cause drivers of autoimmunity that people need to address if they're wanting to put their autoimmune condition into remission?
Well, I think that there's certain things in our foods that can cause this to get a lot worse. One
Mm,
of them being gluten. And gluten is it's a glue. And what it does is it holds the protein bonds together, proteins found in wheat and other types of things. Food manufacturers monkey around with the process of making this stuff so that um, bread is softer and cupcakes are fluffier and everything looks better to when you're going food shopping.
yeah.
These companies really don't care about your health. They only care about the bottom line, about making a profit. And so
Yeah.
when I was a kid back in the 70s, it was completely different. They have they found that people from Europe that visit the United States and eat our food get really sick. Whereas people from America can go to Europe, go to Italy or go to Germany or someplace like that. They eat bread, they eat pasta that's not riddled with the genetically modified organisms like we have here.
Hmm.
And they don't get sick at all. People that are really, really bad off with gluten sensitivity. It used to be that the medical doctors thought that the only people that had to worry about this had celiac disease. Celiac disease is an autoimmune condition, and what happens is that those finger-like projections that stick out from the cell from the middle of the small intestine, they start to shrink and get really small. And so the food can pass through the small intestine and not get absorbed. So people that have celiac disease suffer from malnutrition. They could be eating 6,000 calories a day and still not be able to absorb things correctly and not get into their system properly. Nowadays that we know that you don't have to have celiac disease to have a sensitivity. I myself have non-celiac gluten sensitivity. So
Same.
yeah, so what
I haven't
happens
eaten
is
it
that
in like 5 or 6 years because I can't
yeah.
do it.
So I could go to my in-laws' house and they could serve some pizza and I have a piece of pizza and then I get really, really sick within
Hmm.
like a couple of hours. And I think that a lot of this can be traced back to the foods that we buy and the foods that we cook as the one of the root causes or one of the things that has to change.
Yeah.
And for people that suffer with this problem.
Yeah, I definitely agree. Food plays a very big role, both in like your gut health, but also in like inflammation and your body's ability to just like manage your health because of if your gut is affected, that affects like every other area of your life, especially when leaky gut is involved, or even when like
Yeah.
bacterial, or sorry, microbiome dysbiosis is involved too. What would you say are some other main root cause drivers that you see, maybe like in your environment or stuff like that?
Well, it could be related to what medications you're taking. If it could be related to what vaccines that you take. It could be related to what part of the country you're from. Certain parts of the country are more industrialized and they have more toxins in the soil than others. I'm from Pittsburgh, Pennsylvania, and once upon a time, this area was very, very industrialized. It was the steel hub of the entire world up until the 70s. And so there's more cancers per capita than any other part of the country in
Mm,
Pittsburgh. And I think that that plays a role. Your overall level of fitness. So um, I think that it behooves people to not only pay attention to their food, but their activity level, and to try to maintain it and pay attention to their hydration, pay attention to their cardiovascular fitness, their lean muscle tissue, their manage your stress well. All of that plays a factor. It's not just one thing. I think that it's a constellation of different things that
yeah,
goes to your overall health and wellness.
yeah, absolutely. Um, I would love to dive a little bit into how you help manage patients or sorry, support patients who are wanting to get autoimmunity into remission. And the first question that I kind of have in that is for someone who has been on long-term medication, or maybe they've been told they need to be on long-term medication, and they've maybe just started it or been on it for a little bit. How do you safely taper someone off long-term medication, and when do you know when it's appropriate to do that?
Okay, that's a great question. So, first of all, whoever put that person on the drug has to be the one to take them off the drug. That's just common courtesy.
Hmm.
And so, when a person is under my care and they're feeling better, they're they're doing better, their lab markers have improved a lot. What I would say to them is to go to the doctor that put them on the drug, that immunosuppressant drug, and say, Doc, I'm working with a natural healthcare practitioner. He's done a lot of lifestyle modifications with me. Um, I think this is my current labs. This is the labs I had before. This is where I am now. I think that it's time that we had a conversation about either taking me off this drug or reducing the dosage. What are your thoughts, sir? And if you approach a doctor in a very polite tone of voice like that, not very adversarial, but more like cooperative, I think that they are going to be all on board.
Yeah.
Medical doctors should not have a vested interest in keeping you on that drug. There should be a medical necessity behind every clinical decision-making process that happens.
Hmm.
And so what I would do is I would emphasize the importance of clear communication and emphasize that their approach is over here, my approach is over here. Since you switched over to my approach, you've gotten better. I think it's time for you to talk to your doctor to see if we can make some changes.
Okay. So just to clarify, when a patient with an autoimmune condition comes to you and they're on a immunosuppressant, you wait until they have reduced antibodies to taper them off medication. Is that what you typically, or obviously like ask their doctor if that's right for them? Does that
Right.
sound right?
Yeah, so the type of medications that medical doctors will typically prescribe for people are called immunosuppressants. They're trying to reduce the level of the immune system to calm it down a little bit. And a lot of times that comes in the form of steroid therapy. And these types of medications need to be administered very, very carefully. You can't exceed a certain dose. Otherwise, um, you're at risk of a cold or a flu or some kind of other opportunistic infection. And so if you ever know somebody that has a bad knee or a bad hip and they want to get cortisone injections, that's a steroid. So they can only do that every 3 months or so. Otherwise, they could crash their immune system and they could get really, really sick. So the doctors can only do that every so often. The same thing holds true with a um, one of the dozens and dozens of immunosuppressants that you see on TV advertised all the time to control some kind of an autoimmune disease.
Hmm.
And my philosophy is that just like there's more than one way to cook an egg, there's more than one way to fix a health problem. Drugs are one solution, but it's not the only one that's available to people. And by opening their reality a little bit and keeping their mind open, they can find all kinds of better ways to fix a problem other than drugs.
Okay. If someone comes to you and maybe they've been super recently diagnosed with an autoimmune condition and their doctor has recommended immunosuppressants, but maybe they're not keen about that idea and they're trying to explore their options, what would you say to them?
Well, I would find out if they're better off on the immunosuppressant drugs. Sometimes people need to take these medications. There's no doubt about that. So, if they are on a drug and they're not keen by taking the drug, I would find out what the problem is, what are the circumstances that cause this potentially to happen. Is there something that I can do to help them without further taking medications? And if they absolutely need it, I will be the first person to say, I think that you're better off taking this medication. You know,
Yeah.
sometimes functional medicine can be a good replacement for traditional allopathic medications or allopathic care. Other times, I think that the best thing for the person is just to listen to their doctor and do
Yeah.
whatever they say. I can still help them to get more well. My goal is not to chase symptoms. My
Yeah.
goal is to get people healthier, to uh, reduce the level of inflammation, to improve their gut health, improve their adrenal function, get rid of anemias, get rid of blood sugar disorders, or chemical sensitivities, or food sensitivities, or stealth infections, all that stuff, just to improve their overall wellness package. And sometimes medications are absolutely necessary. I think I mentioned this on a previous episode. I'm not anti-drug. I'm not an anti-physician. I just believe that we as a people are over-medicated.
Hmm. Absolutely. So, to give people a little bit of a clue, what are some of the main cues that you look for to know, like, okay, I do think that this person does need to get on an immunosuppressant, even if it is more so like temporary?
So I would look at the whole entire picture. I don't just look at things in isolation. That's a form of what they call reductionism. Reductionism is when you reduce things down to the smallest possible element in order to study it and to fix it. That was actually formulated by Rene Descartes, the famous philosopher. I believe in holism, looking at everything as an all the interplay. Like
Mm.
how does the brain affect the thyroid gland? How does the sex hormones affect the thymus? How does How does your insulin levels affect cortisol? Things like that. So I look at the complex interplay between different things. We'll look at their medical background. We'll do some questionnaires, metabolic questionnaires, neurotransmitter questionnaires, followed up by lab testing. And if looking at all this stuff, if I feel that maybe they are better off by having their case co-managed between me and a rheumatologist or me and their endocrinologist, I will tell the person that's exactly what I think that they ought to do. There's no, I'm not perfect. So there's no one doctor that has all the answers to every question ever made. And sometimes the right thing to do is to co-manage a problem or having them work concurrently with multiple different people on their medical team. Just like uh, how when you go to a dentist, you don't you don't substitute that for your primary care physician. They have two completely different specialties. They both have something important to say.
Yeah, absolutely. Um, as we're kind of coming to the close here of the podcast episode, I think like one of my last questions that I want to ask is what does true remission look like when someone, autoimmune remission look like? And how can someone help maintain remission?
So remission is when the problem is no longer causing problems, no longer causing mischief or an imbalance in your life. Maybe there's still a little bit of the the condition present, or maybe there's a decrease in the amount that it's been adversely affecting your life. So for example, with Hashimoto's disease, if the if the Hashimoto's problem is in remission, if it's no longer driving the process of low thyroid, maybe they can lose weight, they can get a better night's sleep, they can um, have less aches and pains, things like that. That's kind of what you're looking for there. All the different aspects of the symptoms. My Like I said before, my job is not to chase symptoms with a drug, but I do want to look and monitor the symptoms and see what's going on with that person's life and how is it affecting, say, their exercise habits. A person with, say, fibromyalgia or chronic fatigue syndrome, what's going on with that? Are they able to exercise? Are they able to eat clean food? And how's that impacting their energy levels? How's that impacting their ability to have normal libido or normal bowel movements or have normal connective tissue, such as their skin or nails or their hair? And when all those things start to work better, that's remission.
Hmm. And when someone gets into remission, what are some things that you, I guess, like tell people do to help maintain it and keep the autoimmunity into remission?
Well, I think that the key to that is just to practice the wellness lifestyle, to eat as close to a perfect diet as you can, to make sure that you're getting plenty of sleep, to exercise, monitor your stress or manage your stress correctly, manage your posture and your nervous system through chiropractic care or an occasional massage. Um, one of the scientists who she discovered the opiate receptor. Her name is Candace Pert, and she is a very famous doctor. She wrote the book The Upcoming Plague. She said that when she feels like she's got a sickness coming on, she doesn't go to a doctor. She goes to a chiropractor, she gets a massage, and then she cleans up her diet. So this is a woman that is so far ahead of her time. Back in the 70s, she was saying this stuff. And she knew that those are the things that you need to do to keep yourself in tip-top shape. And I think that there's a lot of wisdom in that.
Yeah, I agree. Now, last thing that I want to share with my audience today, for someone who is listening who may feel discouraged or maybe stuck on medications that they maybe don't want to be on for the rest of their lives, what is the first thing that you would recommend for them to focus on today?
Definitely nutrition. Nutrition is the thing. It's a cornerstone of all health. So I would work on that first and foremost. I would stop eating junk food. I would stop eating fried foods. I would stop eating processed foods, heavily processed foods. Um, get back to raw foods. Get back to a a healthy diet, something a very, very high quality diet, and pay attention to how often you're eating, and not only the calories, but the actual constituency of the foods. There's no one diet that's going to be right for everybody. Some people are better off on a Mediterranean diet. Some people are better off on a paleo diet. Some people are better off on a carnivore diet or a ketogenic diet. I myself am do very well on a paleo diet. So that's the one that works best for me. But everybody needs to be evaluated for nutrition and to find out which program would be right for them. And then I would definitely, I mean, making sure that you're getting plenty of sleep is a very easy fix. Just going to bed earlier, turn off the TV, turn off the news, turn off the phone, and just get back to really, really good sleep hygiene is something that anybody can do. After that, I mean, working on things like managing your stress through meditation or through going for a walk or um, uh, making sure that you're making sure you're exercising. That could be a little bit more complicated because there's a lot more choices. But just find something that works for you and it's not going to stress you out too much and it's not going to be too hard on your body. Remember, a 55-year-old person is not going to have the same level of fitness as a 22-year-old. So, whereas a 22-year-old can lift weights and run and do all kinds of stuff, maybe that could be a little bit difficult for a 55-year-old. So make sure that that you're doing things as age appropriate and that you can
Hmm.
manage.
Yeah, absolutely. Well, thank you, Dr. Smith, for coming on my podcast again and giving my audience additional education on autoimmunity. I do think that there's a lot of insightful information that people can take from this, especially ones who are maybe newly diagnosed with an autoimmune condition or trying to get off medications. I do think that there's a lot of value in everything that you have said today. So thank you so much for coming on my podcast again. For those of you who want to learn more about your work, I'm going to include the links in the show note. And if this episode gave you a new perspective on what healing can look like, share it with someone who needs hope. Thank you for listening to another episode of the Experience Health Podcast. See you next time. Thanks for listening to another episode of the Experience Health Podcast. If you enjoyed this episode, be sure to follow for more. If you have a question, feel free to shoot me a DM on my Instagram at healthbyrachel with 2 A's. Until next time.